Well, if you are not low income and you need a kidney transplant, you can just forget about it because the Biden administration says you should not be top of the list. You should be at the bottom of the list. Also, if you are not a person of color, you also should forget about trying to become a doctor, no matter how hard you work on your test scores. So we're going to give you these two examples of woke policies doing harm to people who either want to become a medical professional or who just need good medicine. So according to this new proposal, it's a proposal, but it's a crazy one. Well, that's what I think. Let me know if you agree with me as we go over it. If a hospital gives, this is a proposal from the Biden administration, if a hospital gives too few kidney transplants to low-income people, the hospital itself will be punished and fined. But if they give the transplants to low-income people, then the hospital stands to make more money from Medicaid, which means that anyone making a decent living would be punished by getting moved way down the kidney list. Now, these kidney lists, obviously, they don't just have an assembly line of donors. So when a kidney comes in from a donor that's acceptable, they're going to say which donor here is the hospital going to profit from, and recipient, and which recipient then, is not a low-income person. We might end up paying out of pocket. Well, the low-income person is going to be able to cut the line in front of you, clearly. This is for patients with end-stage renal disease, so not a lot of people with a lot of time. They don't have a lot of time. Here's the proposal. They call it a pilot program to promote kidney transplant hospital accountability by trying payments to value. What value? The word value here I really don't like because it's the value of people. Some people are more valuable to receive the kidney than others. In fact, this is the government will give participating hospitals a participant-specific target. So just think about this, because this is not just about kidneys and low-income people. This is the government deciding, we're going to decide who gets to live and who gets to die. We're going to decide who is the more desirable population to save and get to live, and who's the population we don't really care about. They are, in this case, not just picking winners and losers, they're picking livers and dyers. So here's how it works. For each kidney transplant that the hospital does, they get 1 point. But if they give that kidney to a low-income person, they will get 1.2 points. And at the end of the year, the amount of points a hospital gets determines how much they are paid. If they have more than 60 points, they get paid as much as $8,000 per transplant from Medicaid. But if they have a low score or they gave too many kidneys to not low-income people, they get punished and they may have to pay Medicaid up to $2,000 per person. So what hospital wants to pay out instead of get paid in? So that means if a hospital gets a kidney, they can skip over a recipient if they think that they may be penalized for treating that recipient. Now, the Free Beacon says they're probably trying to do this to make sure that more Black people get kidneys, because a lot of times Black people don't, but they just can't say that for legal reasons. Here's an expert. This person, a professor at the University of Pennsylvania, says they probably don't want to say we're doing this for Black patients because they know they're going to get in trouble with it. So these are ways they're trying to get around it, right? HHS does concede what they say this will shift transplants from one population to another. That's what we're doing. Again, if they can do this, think of all the things that they can then do and decide who gets treatment and who doesn't. Do we want the government doing this? It says the concern with this is that it may be incentivizing shifting of kidney transplants from one type of patient to another, but they go on diversity, basically.
Tracy Smith in our chat says, WTF. Graffiti Forensic says, a shortage of qualified professionals is impacting healthcare here in parts of Connecticut. I believe DEI is playing a role in this.
Oh, I'm going to show you that in a second. You are absolutely correct.
Yeah.
Well, it's interesting that they've essentially gamified kidney transplants.
Yeah.
Like with the point system, like where they'll have hospitals go, come on, we got to get up to 20 points. We got to get up to 20 points this month. Like, let's get that guy out of here. That's insane.
David, our esteemed producer David, says that he believes that they want to basically weed people out who aren't dependent on the government. So if you're not dependent on the government, you can die off.
I mean, their thought did cross my mind. Yeah. Absolutely true. So what do you think? Does this actually address health disparities in people of color and low-income people? You would think that maybe they would come up with a better way to do that, like, oh, let's help those communities eat better or not be saturated with fast foods or,
have a grocery store.
Right. Not live in polluted areas
like
or that not pollute their waterways. But no, let them get sick and then we'll treat them.
Like J.J. Carroll was just in Chicago covering, of course, the immigration debacle. And he said, they don't even have grocery stores in these communities. They've been completely decimated. They have to go shop for food at the gas station.
Ugh.
Maybe help those communities out, Biden administration.
They call them food deserts. And there's like several locations across the United States, usually in urban areas, where they call them food deserts. There is nowhere to go buy groceries. It doesn't exist.
Yeah. So maybe do that. Maybe help those people get fresh foods and fresh vegetables and fresh meats and things like that instead of processed food. And you're keeping them dependent on this cycle of poverty.
Absolutely. And one thing in the point system is that they do get points if the kidney recipient lives longer. But they get fewer points for that. So they may think, well, do I give it to this kind of obese person of color? They may not live and will lose points. But I'll get extra points because they're a low-income person, or do I give it to the healthier person? They might live, so but you get fewer points if they live. It's crazy. It's crazy to make a hospital, be gamified and make these decisions.
Parallel Earth.
Playing God, essentially.
Parallel Earth 33 is a member of our channel. Thank you, guys. By the way, if you subscribe, your name will pop up here on the big screen, by the way, during the show. Thank you. Parallel Earth says, I drove for Yellow Cab, and all of the dialysis patients are low income.
Yes. There are more. They are disproportionately low income because, of the opportunities for optimal health in those communities. So that's a good point. So while we're talking about healthcare, another Free Beacon report shows that UCLA has significantly lowered its standards for medical school, so much so that they have totally incompetent doctors who don't even know basic arteries and are completely incapable of doing basic medical tasks that you would otherwise expect. Now, we've talked about this. I can show you copious studies that show that when you lower the standards for higher education in order to make up for racial disparities, those students, by and large, do not do well because they were not trained for this kind of schoolwork. In fact, one study shows that when affirmative action students do get into universities, they often change their majors away from math and science majors that they had originally wanted to do because they're just not trained. They're ill-equipped. And if you want children of color to go to better schools, you have to start giving them these, not incentives, giving them a better early childhood education. Blind grading systems. You have to invest in them when they're young and train them all the way. You can't take someone who hasn't been well prepared and just throw them into the fire. It's not a kindness. But the Free Beacon interviewed professors and administrators and found that UCLA has in fact prioritized diversity over merit, resulting in progressively less qualified candidates that are now struggling to succeed. This person says that race-based admissions have turned UCLA into a failed medical school. She said, we want racial diversity so badly. Well, I don't know if this is a she, so it could be a he. We want racial diversity so badly, we're willing to cut corners to get it. And they talked to all of these people who worked at UCLA Medical School to corroborate this. Now, this idea of they want diversity so badly. Why should a medical school want that? Shouldn't a medical school want just the best doctors? Period.
You think?
That really should be the only thing that they really want.
I like that plan.
If I'm going to go get a kidney out, I'm going to go to that doctor.
Yeah.
The best.
Yes.
Yeah, that's
you
the
don't
choice.
care what their race is at all. You only care if they are the best. But, UCLA is flipping that and saying, we don't care if they're the best. We want them to be the darkest, apparently. They don't want Asians. We're going to show you that in a second. Some studies show that Asians have to score up to 300 points higher on standardized exams in order to be considered because it's it's neo-racist. They absolutely don't want Asians. Now, this Free Beacon story tells the story of students who did score low, well below where you should be to get into UCLA. And they got in. And because of this, UCLA has dropped in US News and World Report's rankings, which is a scam. So hardly a bellwether. But they also are failing standardized tests. And the number has increased tenfold, the number of failures, since this dean of admissions, Jennifer Lucero, took over. And now they cannot do even basic medical tasks. Look at this. One professor said that a student in the operating room could not identify a major artery when asked, then berated the professor for putting her on the spot. Like, okay, that's not how it works in Grey's Anatomy. You got to know it or you're going to get reamed out. You can't ream out the attending. When did that happen?
That's like that. Wait till she finds out how surgery works, because I mean, when you're in there and you're like, well, just any artery will do. No. Just you got to know exactly where you're going.
Yeah, that one there. Yeah, cut that one.
Precision counts in this game. Precision counts.
Yes.
You'll get that 1.2 points if they die.
Another said that students at the end of their clinical rotations don't know basic lab tests, and in some cases are unable to present patients. This professor says, I don't know how some of these students are going to be junior doctors. Faculty are seeing a shocking decline in knowledge of medical students. So I don't know, these medical dramas like Grey's Anatomy do so well because we love to see the high pressure that doctors go through in order to help the community. So soon we're going to start seeing fiction of like, whatever, right? It's not hard to be a doctor. Anybody can do it. It's the opposite of Grey's Anatomy. Now, how does this happen? Like, who is consciously making these choices? Well, we don't have to guess, because last year when the Supreme Court ruled against affirmative action in the Students for Fair Admissions versus University of North Carolina case, we saw evidence of how this is done. This is either a Slack channel or some kind of text correspondent. In reviewing applications, admissions officers focus intently on the applicant's race, as revealed in this online chat by admissions officers. Okay, so we're just going to read it. I just opened a brown girl who's an 810 SAT. If you don't know SAT, that's not great, right? You want to be 1300 and above to get into to be considered a really good score.
When she says, I just opened a brown girl,
like opened the application.
Oh, okay.
I was in the high 1200s, in case you're wondering.
I was in 1300 was like my weakest SAT
really?
test. Yeah.
Okay.
I went in hungover that morning. So
shut up. In high school. Don't say that. Don't let our kids hear you say that. Okay, let's go back to this crazy conversation. I just opened a brown girl who's an 810. If it's a brown and above 1300, put her in for this extra scholarship. So yes, give those brown babies a shot at the merit money. I am reading an American Indian. With these, I don't know what URM kids, I'm trying to at least give them a chance to compete, even if the extracurriculars and essays are just average. I don't think I can admit or defer this brown girl. Perfect 2400 SAT and all 5 on AP and 1B in 11th. Brown? So excited. Heck no. Asian. Oh, of course. She's disappointed, whoever this is. Still impressive.
Oh, of course. Still impressive.
Okay. She was so excited. Yay, a brown girl. I'm just reading a black girl who's an MC and a park nominee. They're literally wheeling and dealing these kids by their skin color. This is disgusting and wrong, clearly. And at UCLA, when a person of color was rejected, everyone got punished. Take a look at this. After a Native American applicant was rejected in 2021, this head of admissions, she chewed everyone out and she made them sit through a 2-hour lecture on Native history delivered by her sister. And no applications were reviewed that day because she really wanted them to sit and think about it, what it meant to reject this girl or person who was Native American but didn't have the scores to get in.
URM means unaccompanied refugee minor.
Oh, okay. That's why they want that so bad. They want to give them a chance. Okay. Yeah. Even if it says they don't have good extracurriculars and their essays are just average. So against the other kids. All right. So a lot of people have resigned because who would want to work there and be subject to a 2-hour lecture on Native American history when you don't admit the person that she wants? Is this even legal? It's not. And in fact, This has been reported many times to UCLA's Discrimination Prevention Office, which has received several complaints, but they said none of this rose to the level of an investigation. Okay. Even with falling achievement levels, they've had to add classes to their roster to fit this diversity hire, but then look at their fail rate. They're saying there's at least a quarter fail rate. And for first year students, they said the ones that don't know where arteries are, they can't pass their tests, but they're spending hours in classes like structural racism and health equality, or covering topics like fat phobia. They have all of these woke classes, but they can't actually do the medicine. And another professor said, this is just a colossal failure. The new curriculum is not working, and the students are grossly unprepared for clinical rotations. Nearly a fourth, I said a third earlier, I'm sorry. It's nearly a fourth of medical students in the class of 2025 have failed 3 or more shelf exams. Data from the school shows, forcing some students to repeat classes, persuading others to postpone a different test, the Step 2 licensing exam that's typically taken in the third year of medical school and is a prerequisite for residency. A fourth of them are failing, and they're like, oh, it's okay, just try again. I don't want that doctor who's just going to try again, right? You got to pass this. You got to be able to do the work. So, you know the saying, have you ever heard this, never have a surgery in July? Do you know why that is?
No.
Because you might get a freshly graduated med student, like a brand new doctor that's just graduated. So you want to wait a little bit till they get. So anyway, maybe now the saying is, don't get an elite university doctor. That's not what you want, right?
Right. Yeah.
So let us know what you think of this.
Can you find out like ahead of time? Like, is this person a DEI hire? Like,
every doctor has their, credentials on their website.
Yeah.
So you can definitely say like, oh, I mean, at this point, based on this data, UCLA class of 2025 is something I might just start filtering for.
Right. That's a good point. It's like, I won't fly a Boeing flight. It's like, okay, can you filter out Boeing airplanes? Can you filter out UCLA class of 2025?
Right. And I love to dump on UCLA because I went to USC. So screw them.
Okay.
Go ahead, Philip.
And I find myself suddenly like really backing the idea of AI surgeons.
Right.
Let's get some robots in there.
Yeah.
Yeah.
Yeah. Elon Musk, do you have some robots that can take over for these DEI hires? I'd love to get in there with some surgery.
One of the things the state of California has said is that it supports blind applicant processes. So you don't look at somebody based on their race or gender or anything like that. You just look at their essay and their achievements, their scores, their grades, and that kind of thing. And this woman specifically said that is not required. We absolutely do not want to do that. She couldn't even stomach the idea of a blind application process. But of course, that would be better for everybody. That means we would get better doctors, period. But she can't have that, right? So she's going to get people killed with doctors that don't know which artery to work on.